Recommendations for the screening, diagnosis, and treatment of various diseases often differ by organization, making it difficult to know which ones to follow. To help doctors and patients understand how high-quality, evidence-based recommendations are developed and inform their decisions, the American College of Physicians has released a paper that presents its methods for developing clinical guidelines and guidance statements. The paper is published in Annals of Internal Medicine.
The hallmark of the ACP's methodology is that we base our clinical guidelines and clinical guidance statements on the best available scientific evidence.
ACP's methodology meets the standards of the Guidelines International Network and the National Academy of Medicine.
It is important for physicians, other clinicians, and patients and their caregivers to understand that the ACP uses rigorous standards to ensure the production of trustworthy, high-quality, and useful clinical policy papers and recommendations.
ACP develops clinical guidelines based on a systematic review of the available evidence and produces guidance statements on topics where several clinical guidelines issued by other organizations are available but are conflicting. The aim of ACP guidance statements is to reconcile clinical guidelines to help physicians provide evidence-based care for their patients.
The ACP considers clinical benefits and harms of an intervention and variations in patient values and preferences in deliberations and recommendations for each clinical guideline.
ACP develops its clinical policy papers through its Clinical Guidelines Committee, a multidisciplinary group of 14 members, 12 of whom are physicians representing general internal medicine and internal medicine subspecialties. The committee also includes 2 non-physician public members with equal standing and terms as the physician members, including voting and authorship privileges.
Financial support for the development of ACP's clinical guidelines and clinical guidance statements is supported exclusively through the ACP's operating budget. The ACP's operating budget also funds evidence reviews commissioned by the ACP.
Read all of ACP's evidence-based clinical guidelines and guidance statements at acponline.org.